Bismillahirrahmanirrahim. Assalamu alaikum. A 33-year-old woman come to the office for evaluation of fluid coming out of both nipples. The fluid is pale gray, and has been leaking intermittently for the past week. She has two healthy children aged 5 and 8. The patient had a copper-containing intrauterine device placed for contraception a few months after the delivery of her younger children and has not used any hormonal contraceptives. She has also a history of mild gastroesophageal reflux for which she take over-the-counter anti-acid. Examination show breast without lumps or nipple abnormalities. Brownish gray discharge is expressed from both nipples and is Gaucher negative. Urine pregnancy test is negative. Which of the following is the appropriate next step in management of this patient? So this patient is 33-year-old woman. She came to the office for evaluation of fluid coming out of both nipples. The fluid is pale gray and has been leaking intermittently for the past 2 weeks. On examination, we show that the breast is normal breast without any palpable lumps or nipple abnormalities. The fluid, the discharge is brownish gray discharge and is expressed from both nipple and is Gaucher negative. So based on this hint, the diagnosis of this question is Glactorrhea. And the management for Glactorrhea is to measure serum, prolactin and TSH level. So here the correct option is choice D, measure prolactin and TSH level. This patient presentation bilateral gray non-bloody nipple discharge is consistent with physiological Glactorrhea. Glactorrhea defined as lactation in men or non-breastfeeding women. It may be a sign of potentially significant disorder and should be evaluated. Physiological Glactorrhea is usually bilateral and Gaucher negative. The appearance is typically milky or clear, but can also be yellow, brown, gray, or green. This patient has bilateral Gaucher negative discharge without sign of malignancy. Initial evaluation should focus on identifying the etiology and include serum prolactin, TSH, and pregnancy tests. Come to the incorrect one, cytological examination. So cytological examination is for the patient having malignancy with unilateral Gaucher positive nipple discharge. Choice B, discontinue anti-acid. So medication are a common cause of Glactorrhea due to dopamine inhibition. For example, antipsychotic, antidepressant, opioids, anti-acid are not known to have this adverse effect. Choice C and F. I will explain choice C and F together. Mammography and ultrasound. So findings suggestive of malignancy include unilateral discharge, serous or bloody, gross or occult rather than milky discharge, palpable breast abnormalities, and associated skin discharge, that is POD orange discharge. These patients require mammography and ultrasound. Choice E, reassurance and routine follow-up. So this patient having Glactorrhea, which is a sign of potentially significant disorder and should be evaluated first. Thank you.